Hi, I'm Michelle Guerrero. I'm a Catholic Charities client. Whenever I was young, growing up, I didn't have the support at home or at school. Trying to get the best grades I could just so I could get that parent interaction so they could be proud of me. It was upsetting because sometimes you would expect them to come and see that I would receive an award and no one would be there. I was offered a 4-year plan scholarship at Tarleton after I graduated. But at that time, I had my son that was barely a month old. But in a family of Hispanics, it's a little bit different. The priority is go straight to work. I realized seeing him in the way he drove wasn't the same as he was before. So I convinced him to go to the eye doctor to get seen just to make sure there wasn't anything going on. It took about 9 months to figure out that he had a pituitary gland tumor. At that time, we had 3 children, and I was expecting my first little girl, and being able to provide for a family was going to be really hard. There was several times between then I wanted to go back to school, but with my husband having the pituitary gland tumor, being laid off, and knowing that the income that I would receive from working at school was not enough was a turning point for me to go back to college. The first day at Roundup, I got to meet Maggie, the Catholic Charity Navigator, and I was interested in knowing more about that program. I thought I wasn't going to qualify, but I was just going to try. She helped me in answering questions, and she encouraged me to sign up.
So Michelle came in ready to learn, honestly. I mean, she was like, yes, give me anything that you can because I want to succeed.
My goal was balancing life and school, being able to time manage my time, because I wasn't that great in time managing, having 4 kids, and then also my husband, and trying to be able to be successful in school.
Some of the resources we provided were utility assistance through Catholic Charities. We were able to pay a couple of her utility bills. We were also able to help her connect with food pantries, both local and at school. So being able to know that, there was food on the table despite not having the funds, but knowing where to guide her to where she could find that was, for me, was a relief because I knew that, okay, they have food today.
What made a big difference with having Maggie from Catholic Charities with me during each midterm of my semester was a breaking point for me because I didn't have that support at home. They would question me whenever I was doing my homework, whenever I had to go to school, you're not bringing in financial resources. So it was really hurtful not having that support.
A barrier that I remember specifically is whenever she came to my office that first semester of nursing school, after it was over, she came in and I knew she was upset. She had not passed her last final and she was really devastated. She cried in my office and I just let her. I think that's what she really needed at that point. She needed somebody to, not only somebody, but a place where she felt safe.
Whenever I started receiving the calls and offers from the hospitals, I knew my family financially was going to be more stable. We had been struggling financially with no support from our outer family, going through my husband having to go once again for surgery. I accepted a position at Hendricks Health in Brownwood, Texas, as an RN at the ICU. I believed it was the right place to work at. During the interview, I got information regarding about the culture, the persons, the team, and the opportunity to be able to grow as a nurse and to grow and expand my skills as well.
My favorite part about being a client navigator here at Catholic Charities is just walking alongside their journey, being able to be their support system, being able to ultimately see them walk the stage to obtaining at what one point was unobtainable goal for them, and being able to tell them, like, look, you made it. It's proof. You can do it.
If I did not have Catholic Charities, I don't think I would have been successful in nursing. If I didn't have Maggie on the side of the ring with me, I think I would have probably quit because I didn't have that support at home. Catholic Charities has given me hope. It's given me an opportunity that I didn't have before. It has made me grow as a person. It expanded my skills and knowledge to become a better person in life. If I didn't have Catholic Charities, I wouldn't have been able to reach my end goal of being a nurse, to be able to provide for my family as well, and to be able to make a difference in my future patients' lives.